Now, ready. Okay, very good evening. Sorry for the delay. Some technical issues were there. I think now sorted out. So welcome from SNCC Rehab Foundation. I welcome everyone and all the respected speaker and parents. Welcome to this webinar. I'm Harshali Kharche. I'm the founder and the director of SNCC Rehab Foundation. We are basically from Nagpur. I'll just slightly brief you about SNCC Rehab Foundation. SNCC Rehab is a special needs integration center and rehabilitation is rehab, empowerment, health advocacy and belief. Here our main vision is to empower parents of children with special needs by ensuring their peace of mind, satisfaction and positivity with respect to their child's overall development. So we are looking for their peace of mind at the end of the day. So we have various missions to achieve this vision. So we are going to sensitize and educate the society, professionals, and all the strata of the society. Right now, our SNCC's current areas of work are awareness program, various parent empowerment program we are running. Also, in the child section, we are doing many various activities that empowering our children and also enhancing their learning skill. We have done various informative sections on final advisory, advocacy. We are there to support community in terms of mental health and physical health, which is also very important for parents in overall development of child. When parents are happy, then naturally that child is happy. So in case of special needs families and children, it's very much important to look after parents' health as well. So many more projects are in the pipeline, but today we are here to discuss about special children and lovely parents and building their emotional health. So for that, I welcome none other than Dr. Harish Shetty. Everybody know him. I mean, no, did not need any introduction, but I will just brief quickly about him. That Dr. Harish Shetty is a psychiatrist with extensive experience in the field of mental health, especially in connection with disasters. He has worked at Latur in 92 and 93 for a year, at Kandala after the cyclone for a year, evaluated the psycho at Jabalpur and Gujarat after the earthquake for a human rights group, also worked at Gujarat after the last riot of 6 months. This was on the invitation of Amrita Ben Patel, then head of NDDB. Dr. Shetty has worked extensively with the youth and worked with an educational institute every week. He has also provided mental health interventions to seafarers after their release from the clutches of Somalian pirates. He is governing body member of NTA appointed by the government of India. I also welcome Dr. Surbhi Trivedi ma'am. She is a psychiatrist. She is a consultant psychiatrist at Ojas Clinic, Vilepale, Mumbai. She is visiting consultant psychiatrist at Hiranandani Hospital, Nanavati Max Super Specialty Hospital in Mumbai. Also in S.R. Mehta and Sir K.P. Cardiac Institution, Mumbai. She worked as a consultant psychiatrist at Maitri, an NGO working with patients of mental illness and their families. She also worked as assistant professor in Department of Psychiatry at Government Medical College, Miras. She received awards for research paper presentation at national level conferences. So with this introduction, I welcome to our respected speaker, and I'll hand over to Brian Rodriguez out to take this further. Thank you. You are on mute, Brian.
Sorry, good evening to everyone. Good evening, Dr. Harish, and good evening, Dr. Survi. But in fact, before even starting the insightful session, what we had done at SNCC, is we carried out a survey just to get an insight from people that when a word psychiatrist comes, what is the exact thing which comes to our mind? Because when it comes to psychiatry, it has always been remain under cover, closed doors, and no one looks at it so seriously because it's been like a taboo. So certain things like psychiatrist is someone who treats mad people, or because of this, the the pointers which came that psychiatrist only deals with counseling, or it's something came like it's fast, or it's a big help. These are some of the out of the 400 500 replies that came. So a few 40 50 of them came up with a very varied kind of definition when it comes to psychiatry. So we wanted to build and bridge this gap so that people really understand that what is a real role of a psychiatrist in the mental health of parents, as well as not only for special needs parents, even for general individuals as such. So we'd like to have your insight, Dr. Hari, so that that we come out of this mental block and we reach out for help, because only when you reach out can you solve your issues and you can come out as a winner.
Absolutely, Brian. I'm so happy to hear those words. You are attempting to break the stigma of mental health and the stigma of psychiatry. Thank you, Harshali, Ashok Shah, Brian, and others for inviting us. Let me say something before Dr. Surbi starts. Let me congratulate all parents who have had very difficult times, many of them during the pandemic. Special schools were closed, therapists were not available, schools yet have not started, and probably the medications which were on for a few may have been stopped. And especially in small houses with nuclear families, it must have been so difficult for you to live in the last 2 years. I've seen these difficulties in so many families, so tough, but you have really been resilient across time. And I think I congratulate you for this. And for all those who had COVID, I wish them recovery. I wish them good health. And for all those who have lost acquaintances, family members, neighbors, and also children, my deepest condolences to all the families across the world. Malaysia, Bombay, Maharashtra, Dubai, United States of America, everybody who has joined here. My deepest condolences. What we are going to do now is very, very clear. Harshali and Dr. and Mr. Rodriguez, Brian, and Ashok have said that let us break the myth of and stigma of psychiatry. That's why we are here. But we cannot break that without talking about our children. It's impossible. And though Surbi has been introduced by Harshali, I would add a couple of introductions. Surbi is one of the finest psychiatrists in the country, has worked with children at TNMC, Nair Hospital, and has been talking, treating, writing on subjects of psychiatry across time. Also, she has a brother who has autism, now an adult, and she's been through the journey of a carer, primary carer, nearly a parent and a sibling with a special child. And I would ask her to start her presentation. Then I'll come in when we have little time, and then we'll answer as many questions as we can. We have not kept any time limit for answering the questions. So thank you for inviting us. We are so happy to be here with you all. Over to you, Surbhi.
So, very good evening to all the wonderful parents here. Coming to today's topic, when we talk about emotional mental health, why is our emotional well-being important? So, when a special child with special needs comes into your life, the child does not come with a manual. The child does not come with a manual that teaches you parenting, how to attend to their needs. They don't come with, neither is there any formal training that is available that's going to teach you step by step exactly how you're going to need to manage the child. It's something you're going to need to write your own manual. Obviously, help is available, but everyone is going to need to have their own process and own manuals for managing their child with special needs. So, why emotional mental health is important here? As you go through the process of parenting, there are going to be your ups and downs. There are going to be phases where you feel you are more patient, you are more tolerant, you are more understanding. You also will start cherishing small achievements. You will feel happiness in small things. Along with this, there would also be times when there is guilt, there is anger, there's irritability, there's frustration, there are a lot of worries. So it's very important that you pay attention to your emotional mental health so that you are able to tide through this ups and downs, and you can help your child with special needs effectively. So when we talk about handling our emotional health, first let's try and understand what stressors would come about. What would stress a parent? Broadly, let's classify it into external stressors and internal stressors. External stressors are something that are because of external situations, other people around you. What could be the external things that would stress you out? It could be managing a difficult behavior of the child. It could be attending to their therapist. It could be finding out appointments. It could be figuring out schools. It could be explaining to family and friends about the behavior and the needs of your child, and why at times the child behaves the way he or she does. It could be explaining to the sibling of the child about why the behavior and how it needs to be handled. For example, if you find yourself, if you've gone to a social gathering and the child has a meltdown there, how are we going to handle it? That itself puts a parent under stress. Some learn in the course, some would have already learned, but initially when this happens, it's difficult. Why is it difficult? It's difficult because of the situation. You are in a social gathering, the child has held a meltdown, you don't know what to do. The child might be crying, the child might be going through distress. So, what are the things that a parent would experience? Maybe some bit of guilt for getting the child at the function, for exposing the child to so much of stimulation that the child has had a meltdown, for letting other people see your child in that situation. There could be some bit of shame because everyone else around you is looking at you. There could be some bit of anger because people around you, some are going to empathize. Some don't know you or don't know about the special needs of your child. They might just think it's a tantrum. It's a child who's just throwing a tantrum, and you might get a lot of advices around you. So this might also bring about some bit of anger or irritability. When this happens, it's going to so many emotions running inside you. It's going to hamper you taking effective care of your child at that moment. So what can be done in such situations? What could we do? Maybe think about it. Think about it after you've gone through this once. Think about it. What are the things that are under my control? What are the things that are not under my control? Why this happened? What could have been changed? Is there something that I could have changed so that chances of this happening in future are less? Or is it something that I can do in which I can handle this situation a little better? You are in a social function, so probably the stimulation that is happening around that cannot be decreased. Yes, but in cases in which you are able to handle that, maybe if you're going out for shopping or you're going out for a walk, start off with taking the child out when there are lesser people around, there is lesser noise around. If noise is something that is troubling your child, you can start taking the child for regular walks, maybe start playing some games, start exposing them to some music, anything that you feel helps your child to calm down. That would be again different for each and every child. If I'm expecting everyone around me to be able to understand what is happening, why it's happening, probably that is also not right. There would be some people who are understanding, but some don't know me or some don't know the child. So, is it okay? People might give their own opinions based on their own perceptions. Let's not react to that. Let not that impact me taking care of my child. Let me just focus on the child and see what is the best I can do. So, in that case, you would be more patient, you would be more calmer, and you would be able to attend to the needs of your child at that point of time. So to manage the various external stresses that we spoke about, what can be done is assess the problem, figure out what things, what can make it better. Amongst the things that can make it better, what is under my control, what is under not my control. What's under my control, how to modify it, and how to work on it. This would most of the times help you handle the external stresses that are causing you to get stressed. Coming to the internal stressors. What are the internal stressors? Internal stresses are something that are inside you. They are your beliefs, they are the expectations, they are the way we perceive things, they are the attitudes that one has that leads to an internal stress. Now, what could be the internal stressors? Let's start off with beliefs. Sometimes we tend to have beliefs that would itself cause stress. Certain beliefs like I need to be there 100% of the time around my child. What my child does, succeeds, fails, completely depends on what I do. If I'm not attending to the needs of my child continuously, I'm not a good parent. If I'm going to give more than my 100%, the world is going to perceive me as a good parent. Or if I'm going to ask for help, or if I'm going to be not around that time, people might think I'm not a good parent. Or it's not okay to give myself time. It would be too selfish if I take out time for myself and don't give that much time to my child. I would be very selfish. These are the beliefs that are also going to lead to stress. What you need to understand and remember is you are also important. Your self-care is important. If you are okay, you're going to be able to tend to the needs much better. So, as it's your responsibility to take care of your child, your family, it's also your responsibility to take care of yourself. Look after your food. Look after your sleeping pattern. Take out some time in the day for exercise. Not saying that you need to take 1 hour out or 2 hours out. That's pretty difficult. At least 15-20 minutes or half an hour. Take that much time out, exercise. Take some time out in a week, maybe an hour or so. Give it to your hobby. Again, this you might feel guilty about doing things that will make you feel happy, keeping your child aside. You might feel guilt about it, but that's essential. That's essential to prevent burnout that might happen. Because if you're going to constantly focus on the needs, there's a chance there will be a burnout in some time. And that burnout is further going to affect the caretaking of your child. Ask for help. Take some time out. Maybe if you have family or friends, someone who can take care of the child for some period of time, for maybe a couple of hours, once in a while, do that. Take a break, go out, do things that would help you relax. If family, friends is not possible, try to have maybe your spouse can take care of the child, you can take a time out, and then when you are around, your spouse can take a time out. This way, you're not being selfish, but you're giving time to yourself to just be able to function efficiently. So it's okay to ask for help. Also, children with special needs, they are going to have a lot of physical energy. So to be able to tend to their needs, you also need that much energy. That's the reason some bit of exercise, proper eating habits are very essential. Also, what you could do is maybe make a list. Make a list of what you feel would help you de-stress. So that it could be playing music, it could be going for a walk, it could be talking to a friend, it could be painting. Whatever is going to help you de-stress. Any point of time that you feel you are stressed, try and do those rather than getting yourself again and again back into the cycle. Be more realistic in your expectations with yourself and your child. If the expectations are unrealistic, you will often find yourself at a place where you will feel maybe I did something wrong. That's why I'm not being able to reach here. You will feel guilty about things. So it's very important to have realistic expectations. What you need to remember is parenting. The goal is going to be progress. The final goal is not perfection, it's progress. So when we talk about progress, it's not that there's going to be a smooth flow. There's going to be progress, and eventually we reach a peak. No. Here, there's going to be some progress. There might be some downs. There might be times when you feel that you're going back again. At those times, believe in yourself. Believe in your child. Eventually, you're going to be able to move ahead. You will eventually make the progress. But don't try to keep perfection as the final goal. If you're going to do that, you are going to try and be scoring a 10 on 10 on each and everything, which is practically not possible. And it's going to, if the expectation is that, it's going to finally stress you out. It might just put you into a cycle of stress. You know your child the best. You're going to understand the needs of your child the best. You're going to be the best teacher for your child. So Keep the expectations realistic for you and for your child also. One important thing that all of you also need to keep in mind is how, when we talk to people around us, be it family, friends, anyone around us, we are mindful of what we say. We are mindful that we are not hurting someone, we are not criticizing too much when it's not needed. Same way, be very mindful of what you're talking to yourself. Self talk is also important. Don't criticize yourself too much. We all are human beings. There are times when there might be some ups and downs, some things that you would probably feel is a mistake. But everyone makes a mistake. Don't criticize yourself too much. Don't tell yourself that, okay, this is probably what my child needed from me. How could I not understand? Or how did I not understand what the child wants, what the child is going through? Don't put yourself into that cycle of criticism. It's very important that you appreciate the small goals, the good things that you achieve, the small accomplishments. How many of us do that? Suppose in a day you are able to achieve certain targets or tasks with a child. Do we appreciate ourselves for that? We don't. What happens is, but if something goes wrong, the criticism comes in immediately. The criticism comes in so immediately, and the positive talk doesn't happen. Try and have it the other way around. Don't criticize yourself for the small things. You're doing your best. Try and start appreciating yourself for the positive things that you've been doing instead, or the good things that you have achieved. Try and be more aware of your emotions. It's okay to feel sad, it's okay to feel angry, it's okay to feel irritable, guilty also at times. But it's not okay if you are not acknowledging those emotions. If you get those emotions, rather than pushing them aside, try and be more aware of them. Try to acknowledge them. Don't deny them. Try and talk it out with someone. It could be, it could be your spouse, it could be the family, it could be some friends who are understanding. Try and have your own support network, your support networks whom you know you can fall back on. It could be friends, family, anyone whom you could talk to whenever you are experiencing this emotion. Because pushing these emotions aside is not going to help. They're going to resurface at some point of time. Might as well acknowledge them, address them, so that you are in a better frame of mind. Try and be a member of the community support groups which are there. Doing this, you're going to be able to talk to other parents of children with special needs, similar or different from yours. It will help you understand their learnings. It will help you talk it out, ventilate out, express yourself, and you can also share your learnings with them. It's definitely going to benefit someone. So it would be helpful to be a part of the community support group also. What also needs to be remembered is, yes, be aware of your emotions, try to address them, try to acknowledge them. Usually, these emotions would come, and then if you address them appropriately, they would subside. Next time they come, you would know how to address them. Yes, but if you feel that those emotions are being there for a longer period of time, if they are more sustained, as in if there's sadness that you are experiencing, which is more persistent, you feel lethargic, tired all the time, your sleep is disturbed, your appetite is disturbed. You constantly have a feeling of uneasiness, restlessness. You're not able to calm down your thoughts. You're feeling irritable. You feel like crying. You don't feel like putting in effort. You don't see hope in things. You feel helpless. If things like this are more consistent, if they keep giving you distress, or if they are going to keep impacting your functioning, it could be your personal functioning or your professional functioning, then it's important to take an opinion of a mental health professional, preferably a psychiatrist. Doing this, you will be able to understand if there is something that needs to be addressed, that needs to be addressed medically to help you feel better. It would be as simple as, if I have a fracture in my right hand, I'm going to go to an orthopedic to show it and follow the advice. At least understand what is wrong. If is something majorly wrong, is there a plaster needed, is there a surgery needed? Similarly, if these feelings, emotions are not letting you be at peace, are not letting you function appropriately, please take help from a mental health professional. It would be advisable, so that if something's not okay, it can be recognized, it would be treated at the right time, and you can be back to your baseline state of functioning. So pay attention to your emotional health, because it's essential for you and it's very essential for people around you also. So with this, I would like to hand over to Dr. Harishetty sir.
Thank you, Surbi, for the beautiful nuggets of wisdom. I took 4 lessons here, 4 lessons of progress, not perfection. What a beautiful tip that was. People who strive for perfection get very frustrated. Progress, not perfection. Appreciate self. We never do. Indians, though, we don't appreciate others and we don't appreciate ourselves. We look at all the negatives all the time. इसने ऐसा किया, उसने ऐसा किया, कल खाना नहीं खाया, परसों ये तोड़ा. And that's beautifully said. Awareness of your emotions, that really solves most of the problems. That also stops from our tongue becoming very acidic, because once you're aware of your feelings, it gets exhausted and it goes away. And sharing your learnings. We never share our learnings. We always share our problems. Yesterday I did this to my child. He became calmer. I still remember this, a very hyperactive child. The father said, Dr. Shetty, your medicine, your advice is okay. But when I give him a packet of popcorn and make him sit in front of a movie theater, he is good for 3 days. Chup baithta hai after seeing a movie. And that's a great learning for me as far as that child is concerned. I really like what you said, Dr. Surbi, that we all have wisdom from our experience, and giving it importance and sharing it is fantastic. Thank you, Dr. Surbi. We'll come back to you very soon. Thank you. So as we again go ahead and start, I would like to first tell you all, my dear friends, that if you lock your mind, you're going to be in trouble. In fact, this is an Indian habit. I will not share. मैं मेरा दर्द किसी को भी नहीं बताऊंगा. मैं किसी को तकलीफ देना नहीं चाहता हूं. And that cycle of guilt, not wanting to burden, is more among women than men. माझा मुळे कोणालाही त्रास होऊ नये. I should not give trouble to anybody. And that will destroy you, because you have to live for your child longer than what you want to, or longer than what the script is, much longer than what God has actually ticked in his book. So remember one thing, my dear friend, share this wisdom all over, that if you lock your minds, it will explode inside you. And if it explodes inside you, the family suffers and you suffer. And when I say this, I always would like to tell you, my dear friends, as Harshali has been saying all the time, stress on depression, stress on depression. It is invisible, not always visible. There's a beautiful quote which my friend shared once. And I would like to share with this beautiful audience. Let me tell you, I run a school also. Let me tell you one thing is people who cry may not always be depressed. People who are depressed may not always choose to cry. And my experience is that when actually teachers from normal schools go and work in special schools, they become better teachers. And my experience is mental health professionals who are exposed to different children become better mental health professionals, more better human beings. So my dear friends, depression is invisible. Let me tell you how. You might see somebody very irritable. You might see somebody, no, nothing is happening to you, but I've got pain all over the body. You might see somebody very quiet, not wanting to be out of the bed, and he or she may become lazy. You might see somebody who would want to make a will at the earliest. You might see somebody, and very rarely, because of overwhelming burden, or special children with their parents have passed away due to unnatural circumstances. Depression is invisible. You can make it visible by saying, "Ha, mujhe depression ho raha hai, mujhe kuch karna hai. I should do something about it." And my dear friends, a lot of parents of special children come and tell me, "So we should hear this," and they tell me that, "You know why I'm depressed? I'm depressed because of the special child." Not really. Maybe it is true partially in terms of the trigger, but if I carry my car, take my car and hit Harshali on the road, arresting me will not treat a fracture. The cause is irrelevant when you have a fracture of the mind, as Dr. Sabi beautifully said. The cause is absolutely irrelevant. So once you have a fracture, Mala Bhagwat nahi, mujhe dikhta nahi, I can't see this child. I feel very guilty. I am a bad mother. I'm a bad father. I must have done some crime in my past life, something bad. It is because of the sin, or it is because my mother sent me laddus which I did not eat at the time of pregnancy. And the more you blame, the worse you get. And whatever are the symptoms, you have to treat it. Once the fracture is set in, arresting Harish Shetty and even hanging him will not cure the physical fracture which I bring upon Harshali when I drive. So remember one thing, depression is invisible and you need to make it visible. One important message for all parents. When I tell parents, do you know of anybody who can spend time with the child? He's saying, who will spend the time? You don't know how to raise a special child. I honestly don't know how to raise a special child. Honestly, I admit that whatever you are doing for your children is a million times more than anybody who's doing for any child. I accept that. But having said that, I hear these sentences from families. And my child who has autism or CP or cerebral palsy, or he is high functional. I cannot take him to that other child's family who is not high functional. It will affect him. I want everybody as good as my child, so that when they meet, that would be nice. I am very careful who my child will interact with. Arre Baba. I tell all parents, Dunia ko bolo, tell the world that you have a special child. Few will come and say, I can help you. It may not be your family. I still remember when I used to run the support group for the mental ill, where Dr. Surbi actually was doing all the work, not me. When people announce that they have schizophrenia and announce it loud, hey, many people, one or two young boys, young adults said, I would like to spend time with your father. Once a week, I can give you 2 hours of time. In different countries, people donate time. People actually donate time. And that is why what is very important is donating time is also seva. And when you really put it across, you'll find there would be some people. You have to be careful who comes to share the time with your child or your adult. But let me tell you, kill shame, seek help. There's no shame, there's no blame if you have a child who's different. It is simply an accident of the universe. And that is something we need to do very early in life. आता इतपर्यंत अब तक यहाँ तक आया, अभी मैं बोलने के लिए तैयार नहीं यार, इतना आया तभी भी बोलने का, इतना. If it's small, you have to start saying, yeah, I do have a child who's autism. He has speech issues also. I take him to a therapist. I have an elder boy at home. I don't know why. I really don't know how to really help him with his studies. He's also ignored. And the building in the kitty party, we share this. I want kitty party women and men to really do CSR, corporate social responsibility, without your corporate, to teach children who are ignored because the mother and the father have to really take care of the special child, to take care of the other sibling who's ignored, to take care of the special child for a walk. And I think this is what I mean by sinking differences and spreading your network wide. Sometimes it is difficult. People will give you all sort of advices. Stem cell karo, ye karo. No. So you have to be careful also. You need to really look and analyze those help givers, because they would say it out of their good intention. Everybody's intentions are honest, but the methods may not be right. So sing differences, spread your word wide, kill shame, seek help, and let people offer time. And that is something which is important and which is really possible. Now, I have failed here. In fact, I'll tell you, this is my failure in the last 25 years. What happens after some time is, dharu pan shakat nahi, sodu pan shakat nahi. पकड़ भी नहीं सकते हैं, छोड़ भी नहीं सकते हैं. We cannot hold them, we cannot leave them. And every mother or every father feels nobody can take care of my child as good as I can. It is like the businessman who sits on his counter every day and refuses to go home and spends 18 hours will not delegate his work, because if he actually delegates, the work will be approximately 10% less effective than what happens when he's there. But that's okay. मेरा जैसा मेरा बच्चे को कोई नहीं समझता, जरूरत नहीं है यार. And at some point of time, 4-5 लोगों को इकट्ठा करके एक सेंटर में एक हफ्ते के लिए ऐसे रखना, और हम सब थोड़ा गणपतिपुळे होके आने में कोई दिक्कत नहीं है, which means no harm, and to take a respite break for the families. The more respite break you take, you live longer. See, I'm insisting. ये कह रहा हूँ, we have to lengthen our lives. I'm saying this for the first time in my life. We have to lengthen our lives so that we are there for our children and we are able to make them as independent as we can. And that is something which is very, 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 very important. So respite care would mean we meet, but we don't leave them. So sometimes we leave. Ultimately, he will actually go down from where he was. I have brought him to this level, and in 5 days, no, nothing will happen. Nothing will happen. So centers like you, if you can give this respite care, that would be very, very useful. Now, as somebody said, Dr. Surabhi said it beautifully. Now, let me tell you, when families of special children come to me, I said, you know what? You've really taken care of your child so well, but as of now, we'll not be able to take care of yourself unless you treat yourself. And they will say, Ami aushadha ghenar, I will not take. There are enough people who will say, don't take medicine as far as psychiatrists are concerned. When it comes to diabetes, heart attack, they will not even ask. They will take it quietly. No fighting with the cardiologist. No fighting with the physician. No fighting with the COVID doctor. No fighting with the dengue doctor, malaria doctor. When it comes to psychiatric, how long will I have to take? When will it stop? How should I stop my medicine? I tell them, bhaji, poli, goli. When people harass me and they say how long I should take, I tell them, tell me, my dear friend, October 23rd, 2025, afternoon, what lunch will you eat? Saying, I don't know. Then I also don't know. Let's start the medicines first. Let's wait. And if you have one episode of depression, at least 9 to 12 months, it's maintenance here. Every car has to go to the garage 5,000 kilometers, even if it's good. They have to put oil, they have to do so many other things. So the car is maintained. The way you maintain your car, you have to maintain your mind. And by the way, my dear friends, depression is more common than what it was. And this is something which is very important. Now, as you do this, all parents, mother or father, have some mood lifters and mood shifters. In the sense, no, not the phone. Huh? As a child, I would hum a song when I was scolded by a teacher inside the bathroom. Jor jor se gana gana. And those days, the songs were so different, Brian. It was मेरे भैंस को दंडा क्यों मारा तेरे बाप का वो क्या करती थी. Those Ashok Shah would remember the Shami Kapoor song. So humming a song, reading a book, painting, walking, wandering aimlessly is also one activity I learned from a friend. Kuch nahi samjha, wander aimlessly and come back without reason. It's not window shopping also. I say, telte jane ka aane ka wapas. So all of us have mood lifters and mood shifters. Don't put it down. And let me tell you, my dear parents, don't look for the huge joys. Huh? हम लोग सब लोग पूरा स्कूल फ्रेंड्स मिलेंगे नहीं हो सकता है. सब मिलते मिलते 5 साल जाएगा. So little joys, थोड़ा अभी जाके मैं बाहर जाके एक कप पीऊंगा कॉफी. बाहर जाके पैर ऊपर रख के मैं चाय पीऊंगा. एक वड़ा पाव खा के आऊंगा. One वड़ा पाव, one burger and come. So write down what are your mood lifters and mood. We forget in these vagaries of life, in the kashmakash of life, we forget. Only people like Harshali and Ashok and Brian, they are smiling. I saw the pictures of your kids, Brian. They're very nice. I saw that beautiful picture. So I think it is so important. COVID has taught me to chase small joys. Walk down, just look at the bird, name the plant in your house. So you need to do this. Though a lot of wisdom was shared by Surbhi. And you may say, I knew all this. Knowing all this is not important. Doing all this is important. And we don't do it. And it is important for Dr. Surbhi and me to remind you to do it. And that, I think, is very, very important. Abe Sala, mere baat kya? One, it's a real big question, It happens to families of mental ill patients. It's a big question. And I refuse to romanticize on a few kids who are doing well. No. The few kids who are doing well are not the big picture. The big picture are a large number of kids who need help, who need assistance. And I believe that the state has to formulate certain policies and families should come together and create certain environments so that our kids are safe after we leave. And that has to start right now. Small groups, people have done that, but it can't be very expensive. The autism village, few can afford. So it's so important to think mere baat kya, but that's also important to think that I do not want my other son to get affected because of this boy. I will not. So many patients, they are lost when one parent dies because the other sibling did not know anything about what was happening with this child. So this needs not a philosophical answer, this needs an organized clinical answer. And as I stop, I would tell you, my dear friends, focus on lengthening your years. Take care of your health. अपने को टपकने का नहीं जल्दी. काय Brian बरोबर बोला ना? We have to take care of your health. I mean, this I learned from Hansa Ben Jaidev from the Yoga Institute of Santa Cruz. Those who have difficult issues in the family, the carers have to take care of their health. Nothing doing. And for them to take care of the health, they need this Panchamrut, Swarth, a little selfishness. I will not eat all the butter in the fridge at night. I will not eat all the chocolates which my son has kept. Ata kalla mala kon khate. And that's the first S. Second is Swavalamban. As much reliance as we can. Swasthya, I just said health. Samjhota. certain adjustments. We can't be getting everything as Dr. Subi beautifully said. It is progress and adjust. This is something my son can't do, my daughter can't do. This is something he will not be able to achieve. His cousin came and gave us a box of sweets because she got 99.9 in the COVID time, the 10th standard. But my son did not get. We all started sitting and crying. Arre Baba, 99.9 is not life. If we make our child as swavlambi as we can, self-reliant as we can, and we accept that this is something we will not be able to do. And last is Sambandh. Sambandh is spreading your wings big. And that I think this 5 things I think is extremely important for us to prevent depression. And my dear friends, as I stop, let me tell you, mine is not made of iron and steel. It's made of neurons. Nourish it always, and that is very important. And the last one, समय से सब कुछ होता है, नहीं होता है बॉस, नहीं होता है, नहीं होता है. Brian, होता है क्या? नहीं होता है. We have to intervene, and time is not always the best healer. I really thank all the families because I've learned a lot from you guys. I have learned a lot from you guys all the time, because families have wisdom and they don't believe that they have wisdom. That's the difficult thing. They don't believe that they actually know something. They all have learned across time, and they forget that it's a great learning and they don't share it. As will be said, that we need to actually share. My dear friends, thank you for inviting me. I'm so grateful. I'm so happy. I'm so touched. And let us open this entire series for question and answers. Thank you.
Thank you so much, sir. I mean, I can connect you very well as I'm a parent of 2 special kids on.
I saw the pictures also.
Yeah, on spectrum. So I've also gone through many of the stages you have specified, like depression is invisible, that you said, make it visible. Absolutely, we have to treat it. It's not going to heal it. Like okay, जशी वेज आई, I mean जैसे टाइम जाएगा वैसे अपने आप हील हो जाएगा, नहीं. We have to look after those things and we have to intervene either yourself or take a help. I mean, if you are capable of taking care of your mental health, then you can. But if you can't, then you please seek the help. So some points I really want to stress out is like seek help, okay, and to take respite break. I mean, I also personally feel that it is so necessary to take respite break. And I mean, I can right now I can say then we do a lot of events online. So that is my me time because I get satisfaction out of it. Now kids are on their own, so I'm okay with it. It's small things also are like respite break. So and other good thing is like mood lifter and mood shifters. That is really a nice thing that we should make a list and do that. That is the wonderful thing, sir, you have said. Even lengthen your life. Right, I mean, just in 1 week, I also felt that for myself. You said, don't eat chocolates in the fridge. Yes, I can connect to that because it's sometimes like I use that as my mood lifters, that, okay, going to fridge at 2 o'clock and eating a bite of chocolate. So that I can connect very well to this Panchamrut also. It's a very, very nice and insightful guidance, sir. I think we can take the questions. Anybody wants to ask question, they can raise the hands and or they can put it in the chat box. In the meantime,
I would also ask you to pick up the questions from the Facebook. Somebody can.
Yes. I'm doing that, sir. Yeah. I have got one questions. It's anonymously sent to me. Like, my husband has still not accepted our child's diagnosis even after 4 years. She is thriving there's a lot of improvement, but there is no progress with academics and pre-academics as well. We have 5 years old who also needs our attention, and I get exhausted with the housework and the children, and there's absolutely no help from the spouse till I lose my temper and force him to pinch it in. She's not getting regular OT, no help with academics. He will either get anxious and then be silent and says she'll get better as she grows older. I have taken him along to counselor to help us grow as family, but each time he is adamant that our child will get better. I don't want to burn myself out, but can't get more support from the other adults in the house. Please give us some tips. I've taken this question because most of the families are facing the similar kind of a situation, sir. So, ma'am or sir,
Surbi, start.
yeah, anybody can address this.
Yeah. So, what probably seems to be happening here is normally when a diagnosis is revealed to the family, when a child is diagnosed as the one with special needs, normally parents do tend to go through this phase of there's initially a denial, then there's anger, and then is when acceptance comes in. Probably the father here is not willing to help. Instead of, since she's already taken him to counselors, made him talk, probably he's not willing to accept the diagnosis as of now. What the mother can do is see if the father can help with the other child. Probably he can help there with the other child. The child who doesn't have special needs, and so that she can focus more on the child with special needs. If other family members, like she said, other family members are not willing to help, what she can do is maybe build up a support structure around her, see if there are some other friends, some other relatives around, or join support groups, the community support groups that we were talking about. If she can join one of those that addresses the special needs that her child has, maybe the father attending those meetings, talking to those parents, that would probably help. Or else at least she will have some place, some way of figuring out how to handle the need. She'll get some support from there also. And maybe see if help can be taken for other things. If she's busy attending to needs of both the children, maybe other things of the house, if those could be outsourced to someone else, she can focus more on the children and to herself.
Absolutely. I just would like to add 2 or 3 things. Beautifully answered, Dr. Surbi. One, very father का एक बहुत बड़ी बात है. Ashok Bhai knows because he's interacted with so many fathers and mothers. Number one is sometimes he believes I have to earn for my child. I have to make enough money for my child for the future. And he goes on doing work, and he feels that this is something I don't want to break. If I focus on the child, I lose my mind. I will not be able to focus on my work. That's also a defense, apart from what Dr. Surbi beautifully mentioned. The second is, हर एक का awakening का एक time आता है. I mean, there has to be an awakening. He or she is my blood, my flesh and blood. And sometimes the very ordinary priest, I still remember this incident. I mean, it was Surbi, it was a doctor family, the doctor couple. And this man was very hard when it came to the child. And the maid servant saw that all the time. And she would get very angry with the husband. I don't know what happened to this maid servant. She lost it. And she fired the hell out of this man one day and said, Tula disat nahi, you can't see your wife is struggling day in and day out and you have no heart. And sometimes they stab on the chest from somebody unexpected. And he broke down and he started crying. And that's the time he got awakened and changed. So you never know when people can get awakened. Number 3 is Dr. Ashok, Surbi, Brian, and everybody here. Many fathers are ashamed of their children. They go to all these places and they say, his son doing that, his son, they're ashamed. And they're not able to get over that shame. And sometimes at that point of time, existential confrontation is important. I have said this many times to many fathers. It's not only especially other children. I accuse them, you don't love your children. I just straight away accuse them. I can't go round and round and round all the time. Once we have to, kya karega? Aayega nahi mere paas. He'll go to somebody else. I said, you don't love your children. And that time they dropped the phone, dropped the focus. And what do you mean? I said, you don't love your children. And sometimes, unless there is turmoil in the heart, people don't change. And sometimes creating a turmoil is also very important. Once it so happened that an IAS officer did not actually do anything, and he blocked his mind and he was doing his work. They're traveling and he just said, you take care, I'll get the money, I'll get my salary, you take care. I can't do this. And this was 15 years back, his senior IAS officer was my friend. And he was very close to that senior IAS officer, very, very close. They were bum chums, and he regarded him as a mentor. I broke the confidentiality, told the senior IAS officer, this is what it is, sir. If you can do something to this man. He took him home for lunch or dinner. What they did, I don't know. He said something, and from that day, this man changed. So I think it's so important to use non-orthodox ways also to change people. And awakening can happen in this birth or next birth if you believe. But I think if, as Subi beautifully said, if you can't get along and there's polarized parenting, she should look for other avenues. And what she said, which I liked the most, was he can take care of the sibling who's normal. I'll take care of the sibling who's disturbed. Thank you, ma'am.
Other question.
And here Ritu says, yes, my husband also feels ashamed of my daughter. That's a sharing on the chat box.
Yes.
And that's beautiful sharing. Thank you for your honesty, Ritu.
I got some personalized question in chat box, like what would you suggest to strengthen the bond with your spouse in this, special cases?
Surbi, you answer difficult questions.
Yeah, so what happens is many a times when taking care of a child with special needs, probably every other relationship is put aside, especially the relationship with your spouse, because sometimes that tends to be taken for granted and all the energies are focused here on taking care of the children and other things. But it's very important that the relationship with the spouse also needs to be taken care of. So maybe what we spoke about earlier, take some time off. So if you have someone else who can maybe chip in for some time, who can be around for some time, or right now the things are closed, but once the child starts going to a school or starts going for therapy sessions, in between, if there's some time, take out some time, spend it with your spouse, go out, maybe go out for a movie, go out for a coffee, but spend that time. There's also discuss about, if one is working, one is not working, if both are working, discuss about the other parts of your life also, other than what is happening at home and what is happening with the child. Don't let all the discussions be centered around therapies and the needs of your child. Have other healthier conversations also.
Thank you. And Shilpa is waiting for the question. And thank you, Brian, for saying, for a change, Dr. Shetty, your session did not sound like a pravachan. Shetty without humor is no Shetty. Thank you. So excellent answer, Dr. Subir. I'll give you an example of what happens when there's a child with disability. Marriages break also. And I'll give you one example of one couple. This child had to be taken to therapist continuously, and the mother would take the child to the therapist, and the time spent between the mother and the father actually went down, and the marriage almost has broken. So what is very important here, apart from Dr. Surbi's beautifully said so many things, is that being aware that there is a need to take care of your child, there's a need to take care of the other child, but there's a need to take care of the two big children. And the two big children, if they don't, if they don't also talk to each other, mother has to take care of the father, father has to take care of the mother. So sometimes small touch and soft talk is very good. And small touch is the father sometimes massaging the head of the mother with the oil, and it's allowed. It's a censor approved scene. It's not a crime. So soft touch and small talk is very important. And sometimes the soft touch and small talk brings people together in spite of lack of time. Also, what is very, very important is hugging is not a Western concept. It's a blessed Indian human concept. So without reason, keep hugging each other, children, a spouse. I hug my mom also. She's here with me, and she said, "Oh, what are you doing?" I said, "I'm a psychiatrist. I want to get better. I want to feel better." So very important actually to keep the soft touch and small talk alive, which will keep the marriage alive, because that's amount of work you do with your children exhausts you completely, and the small things might probably revive your marriage. Thank you. Yeah, Shilpa?
Thank you, sir.
Ashwali. Shilpa,
Yeah.
put your hand up.
Yes, I'll unmute Shilpa. Yeah.
Good evening, everybody. Good evening, doctor. Doctor, your talk has given me an insight into a problem I was facing for so many years, maybe since the time I got married. And I thought, oh, this is my destiny. I have to accept my husband the way he is, or maybe he has to accept me the way I am. And then after the birth of our son, who's on the spectrum, like I already had a problem, and then another additional problem, and then I didn't know how to go about it, because I was already feeling very deprived emotionally and all of that. So so doctor, thank you so much for your talk, both the doctors. And doctor, I wanted to ask that if meaning like my husband feels that our son has autism, but then like through therapy it will fade away, and then one day he'll be okay. And then today if I tell somebody that my son has autism, it will be like a label on his head, and tomorrow when he's okay, everybody will still look at him as if he's autistic. That is number one.
Look at him.
Look at him like like as if he still has autism and he's differently able. Number one. And then that prevents him from talking, and that leads him into kind of having a grudge against me when I talk about it openly.
Okay.
And he's like totally like he's like totally put off with me. And like for me it's like, at least I mean, you don't talk to me, you don't have the time, at least like let me talk to somebody else openly. I mean, I can't talk freely with him because he's not I don't know, maybe he's a closed mind, maybe. I don't know, doctor. I'll have to resolve that. And like with your talk, I have got this inspiration that I have to meet somebody to resolve this. I can't go on forever till I die.
Thank you, Shilpa, for your observation. That's an observation. That's not a question. And sometimes one question came in that your child may get upset when you say that he's autism. Yeah, very, very important. That's a very important point. When the child is small, it is easy. But when the child is a teenager, then it may be difficult. But if you can explain to him that when I say should open up, I'm just saying that you should open up more than exactly what you do. But when you explain to him that I do it because I need help and support, and if it's okay with you, it's all right. What are you scared of? Are you scared of something? Are you ashamed of something? And we have Aditya Shah here, who openly accepts his condition, and he shares this so openly. So building that confidence by parents with the help of a counselor is also important. And sometimes we have to respect that confidentiality if he or she says no. And now here, some people have said, I would not give their names. Yes, my husband also says that I'm focusing on the business because of the expenses of therapies. And the person have said that I also have twins with intellectual disability. Brian has said there's something very beautiful. You can't force acceptance and understanding. Awakening has to happen. And somebody else also said that husbands always say that they have to earn the money. Accepted. I mean, point taken.
The one question is like from that I'm hogging like a pig to cope up myself, like eating 12 cookies at a time, both children under spectrum, husband indifferent, don't wanna leave, hate my body, presently 92 kgs. I don't know how to support myself.
Surabhi, you're going to answer difficult questions.
So what she's doing is probably she's stress eating. So by eating so many cookies together, you're trying to self-medicate, but it's a temporary solution to your mood at that point of time. It's not a long-term solution. Plus, it's adding on to weight and other health issues. Right? It is going to not only increase the weight, it's going to cause other weight issues. So it's very important that she takes the help of a psychiatrist, sees if treatment is needed, maybe other rather than self-medicating with food and binge eating on food, there is a better way of addressing what she's going through.
Surbi, I don't think she can address it herself as of now. She's already 92. And I also have this habit of eating that Mysore pak. So in my family, it's banned in the house. Don't get any Mysore pak. But I think it would be a very good idea if they actually go and meet somebody, because as you all know, you have two hormones, one appetite suppressant and other appetite stimulant. And because of stress, the appetite suppressant hormone is not working as well. So you may need some help there. And there is one exercise which you can actually do, known as exposure and response prevention. It's known as ERP, no? Surbi, ERP. So you can get your friends around at night, 12 o'clock, put all the cookies on the table, on the plate, and sit in front of it for some time. And you'll have a lot of saying, only one I will eat. Husband, I'll eat only one. Tomorrow I'll not eat one. And you have to hold on to that and watch your sensations, watch your thoughts and your feelings. And then slowly, once that thought passes off, you'll not feel like eating. And if you practice this very regularly, a lot of people can get over this. Even alcohol, that's a good thing to do. People who have problems with alcohol, they can pour a glass and wait and not actually drink it for 1 hour. So sometimes this works. But honestly, both me and Dr. Surbi believe that if you're 92 and if you are really stress eating, you need to really get going with a doctor, obesity doctor, and a counselor who can really change it here. Simple advice might not work. But once in a while, some people suddenly drop. You know, they do it and they succeed. I don't know how, but sometimes the kid falling sick, that also helps them to stop eating, or they having some physical illness, that also. So, but help is essential. I think we should not leave help aside.
Thank you so much, sir. I'll go to the next question. It's in the private chat box that I'm a mother of two girls. Elder 22 has Rett syndrome, completely dependent for all her needs, non-verbal, and younger 13 years in autism spectrum. Now she's saying my problem is guilty about not being able to give time to elder one, leaving her to maid. That's the
Surbi?
Yes. So here both the children need attention. Probably what needs to be done is balance out time between the two. The guilt is only going to further impact the mother. It's not going to help her resolve the solution. So she needs to figure out if what needs to be more important than the amount of time that she's spending with the two kids is the quality of time that she's spending. The quality, if she's able to divide her time, balance out her time a little bit between both the kids, and yeah, the elder one is dependent, like what she said. She has someone else to take care of the child, but if she's able to spend some quality time with the child, whatever time she's able to spend, then probably she'll not feel guilty And at the same time, the child's needs could also be addressed, both the children.
Absolutely. There's one aspect of guilt I would like to share here is that guilt is also very cultural. It runs in families, and there's a habit. Your mother, you have seen blaming herself all the time as a mother. Maza mole, because of me, I think I'm not good. So sometimes mothers have picked up that attitude from their family. So there are two types of guilt: provoking guilt and invoking guilt. And provoking guilt is because of you, I'm suffering. Invoking guilt is because of me, we are all suffering. So also explore the concept of guilt which he or she has drawn from her own family, and help her analyze from where it comes and from where she has learned. So sometimes adding this concept also in counseling is a very important process. And I think Surbi has answered everything. There is one question about and somebody has written that group exercise is also a very good thing to do, and somebody has lost 4 kgs who has been cheating. So that's a good activity. That's, I think, is very interesting.
Yeah, on similar lines, there is a question that I have heard that regular exercises as simply as morning walk can save you from anxiety and depression. Is there any scientific reason behind this?
Yeah, Surabhi?
Yeah. So what happens is, like, when there's regular exercise, there's regular yoga, any physical activity happening, it does tend to release endorphins, which help the brain. It's not that the person will never suffer from anxiety and depression after that. If it has to happen, if there's a biological predisposition, it might still happen. The only thing is, by doing regular activity, you are building up your brain muscle power. What we do with our physical health, if I'm going to exercise regularly, if I have enough of muscle strengthening exercises, it's going to help protect probably to some extent against a fall or a fracture, but it's not going to prevent it. Similar happens with the exercises and yoga when they regularly happen. That's going to help build up your brain resources. It's going to help build up the brain muscle power. So that if there's a stressful situation, you're probably going to be handling it a little better and the stresses don't get onto you. So you want to...
Absolutely right. Absolutely right. And whoever has asked this, is this scientific? Yes, it is. It is scientific. And remember Black Dog, huh? Black Dog. How many of you know what's Black Dog? Brian, tell me what is Black Dog. Tell me what is Black Dog.
The whiskey, sir.
No. On this forum, which is which is educative, I will never. It is a whiskey, but I'm not talking about the whiskey. I'm talking about a 4-minute movie which the World Health Organization has put, and the name is Black Dog. And the gentleman and each one of us should actually see this movie. And when World Health Organization puts in its research, and they say exercise is a stress buster, it also helps mild depression, and that I think is so important, so important. And exercise dissolves fears, tears, and anger. But as Surbi beautifully said, normal fears. But if you have anxiety, then you may have to take some help. So thank you.
Thank you, sir. When there is a question, when one should approach psychologist or psychiatrist?
Yeah.
I mean, how differently they will be of help? That is the question.
So, yeah, it would be whenever, like I already said, if there is some distress, if your functioning is getting impaired, you probably need to see a mental health professional. Now, what a psychologist will do is they will help you with counseling, they will help you with your coping mechanisms, help change your way of reacting to things, change it to responding. And what a psychiatrist can do is help diagnose if there is a illness, if there is a disorder, help treat it and help guide you through the therapy properly. So in case, this is what I would usually advise if you are not really clear. If you're not really clear whom you should go to, But it's always advisable to see a psychiatrist first. Let a psychiatrist assess if there's a need for medications, if there's a need for therapy, if there's a need for both, and then accordingly follow what is being advised.
Thank you for the great answer. There is somebody saying, Saransh Raut saying regular yoga helps, but few things is not in our hand, but which is in our hand, we can modify it in our way. And there's Dr. Vivek Birla and Deepak Mathur has raised his hand. If you allow him to ask a question. Sneha? No. Harshali?
Yes,
Deepak Mathur?
yes, I've unmuted him. Yes, I've unmuted him.
You see, now my name is Deepak Mathur. I have a 43-year-old daughter. She is not in autism spectrum, but is slightly mentally retarded. Now, you see, she has got no other problem except for some behavioral issues. One is that it is very difficult to make her flexible. She follows the rule. Whatever rule has been laid down in the house, she will try to stick to that. See, but normally a person seeing the situation changes the behavior and maybe little flexible in the rule, which is not acceptable to her. That is one thing. Point number two is that there's a habit of collecting the scrap. You see, if I have put an empty box container in my house as a scrap, she would pick it up and try to reuse it. So that reuse is a good habit, but this extreme reuse is sometimes in a hindrance in life. So these are the two important questions I want to address. How can this be addressed?
Yes, Abhi?
Yeah. So what needs to be done is, like you said, there are these two behaviors, but there is a pattern to that behavior. So probably you need to take help, someone who can help you with behavior therapy that is there. Right? There is something known as cognitive behavior therapy and there's something known as behavior therapy. Considering that there's some part of intellectual disability, what would probably help more is the behavior therapy part. Look into the patterns of the behavior, see what can be worked around. Some help from a professional with behavior therapy will help you modify the behaviors. Maybe they don't settle down completely, but he'll help you modify them. Plus, check if those behaviors are very distressing. What is more distressing about the behavior? Handle that part first. And a little part which might not be distressing for anyone, maybe that can be just put aside for now.
And also, sometimes it may not change. And sometimes if it's not too disturbing for the family, sometimes we might not be able to change everything. So that is something which is important and that can be, but at the same time, you need to take an objective view and see that somebody examines your child in detail. A friendly neighborhood psychologist who works with children, who works with autistic spectrum, or a psychiatrist would be the best option. Dr. Deepak Mathur, very sensitive question, Deepak, and very, very clear question which you've asked. I think beautifully asked. Somebody has written, in psychiatry, are there any therapy sessions rather than giving medicines to special parents? No, don't look at this medicines for special parents. Okay, if you have COVID and if you're in ICU, you need to take oxygen. You can't say, chalo abhi usse thoda baat karke oxygen badayenge. You can't do that. So if you have to take medicine, you take medicine. Special parents is not a category. There are different people in this category with different issues. So all of them cannot be clubbed into one. And sometimes, my dear friend, if medicines are required, you have to take medicines. If it's not required, you may not take any medicine. Thank you for that question. It helps us clarify. Harshali, Dr. Birla.
Yes, sir. Just one question I wanted to take. It's very generalized for women, that I realized that my resilience to stress drops down and I am more vulnerable to stress during premenstrual phase. I get anxious, keep worrying to the extent that it affects my efficiency at work and at home due to overthinking. Is that what I have heard of premenstrual stress syndrome? What is the indication that I need to visit a psychiatrist, psychologist? I'm more at ease during rest of my menstrual cycle. Yeah, that is the
Yes,
question.
Surbi.
Yeah.
Yeah.
So this symptoms
Surbi,
do.
just before that, to add to Deepak Mathur, would you want to share the experience? Your brother would be of the same age or much
Yeah.
younger. Yeah,
He's younger. He's younger.
can you share that experience that Deepak Mathur has helped?
Yeah. So what happens is there might be some bit of rigidity, flexibility might be less to certain things. There are some things, if they are not very distressing to you, if they're not very distressing to the family, probably we can just put them aside. And like in certain cases,
Can you give an
modify
example?
the behavior, modify.
Can you give an example, Surbi? What are the things you put aside with your own brother that would help?
Okay. So, like you said, that there is insistence on maybe picking up things from the trash and doing something, making using it constructively, right? I think that's what he said. So, what can be done is maybe try and keep the trash in a way that it's not accessible to her. Okay, and if there is something that is accessible and she putting it to some use and it's not very troublesome, just let the behavior be. Try to explain, try to take it out behavior wise, but if it doesn't, then you can just let it be.
Okay, now the next question.
Yeah, about premenstrual phase, getting anxiety, anxious, and that stress syndrome.
Yes.
Is-
So premenstrual symptoms do come up at times, and like she's saying, it's been very distressing for her. So, what helps in this case is not only during that period, but regular exercise, yoga, eating healthy, taking care of your sleep time, taking some time off for de-stressing, that usually helps with these symptoms. But if they are very severe and they last for a couple of days and it impacts her too much, she can talk either to maybe a psychiatrist or to her gynec. There is help which is available depending on the severity of the symptoms. If it's only premenstrual or there are some symptoms that are there otherwise also. Sometimes what happens is there's some bit of anxiety or depressive symptoms that are there otherwise, but we are able to handle them during that period. So it doesn't come to the surface, and the premenstrual phase usually worsens the symptoms. So if there's baseline issues, those can be addressed. And if it's only during the premenstrual time, but yeah, if some help of medications is needed, then that can also be done. So she needs to talk to a professional basically to figure it out. If there is a need for treatment, if some lifestyle modifications can work on changing them.
Before we take Mr. Birla's question, Surbi, I would like to ask a question which is there on the chat box. I would not like to name the name. How could I understand this is my threshold to stretch? How do I come to a conclusion that I can't stretch anymore? I should stop doing it. As of now, I'm stretching to any limit by reducing or ignoring all my needs and wants. So, a little about burnout, how to prevent them.
Yes, so that's where we need to work towards keeping a balance. All energies cannot be just focused on one aspect. If everything is going to be focused there, there's going to be burnout, like Sir said, that you're eventually going to get tired and your efficiency of doing that task is also going to come down. So you'll realize your threshold is getting crossed when there is only one thing that keeps playing on your mind. You just focused on addressing one thing at the cost of your health, at the cost of your other relationships, at the cost of other activities that you would do otherwise. So that is when the burnout will probably come in. That is where your threshold will get crossed. So if you feel, it might make you feel tired, you might not feel like doing the activity, but you're doing it just because you're supposed to. You'll keep doing it mechanically. You might feel that you are getting irritable, you are getting tired, your brain is no longer actively involved in it. It just goes about as a mechanical process. You get physical symptoms, your appetite, sleep gets impacted, is when you understand that your threshold is getting crossed. You need to put a stop to it, address it, focus on other things, and work towards finding out a balance so that everything in your life is given equal attention. Maybe one part might need a little more, but that doesn't mean that others are completely ignored.
Fantastic, fantastic. I think that's perfectly correct. And the day when you
Yes.
feel आता बस झाला, अब बस हो गया, and you feel it every day.
It happens like we burn out every day. It happens कि now it's over, but ऐसा फिर से start करना पड़ता है. Evening, okay, we are burnt out. No, restart it. It happens. Okay, I'm unmuting Dr. Vivek Bilasa. Please ask your question.
Hello.
Yes, sir. You're audible.
Yeah, I have a 24-year-old child who's on ASD. Actually, from childhood, he was diagnosed to have only learning disability. In fact, we have visited many centers in Mumbai who were into this ASD or disability diagnosis, but nobody could diagnose ASD. Ultimately, he finished his schooling, college also from St. Xavier's, and when he reached Dubai for doing MBA, that is the time he kept on reading about autism and he diagnosed himself. Then he visited local psychiatrist there in Dubai on his own, and there his diagnosis was confirmed. He has gone through a lot of turmoil since childhood, but now what is happening is, though he has very well read about autism and is very thorough with it and with mental health also, and is extremely intelligent and reads a lot all the time about books. He must be having about 1,000 books related to autism, communication difficulties, how to take care of communication, so many books, and he keeps reading them all the time. But nowadays what has happened is he's started talking a lot about CPTSD and getting troubled by it and not able to sleep. He's troubled by his past memories about bullying in schools and colleges when he's gone through. He at present is a lot into self-advocacy. It gives a lot of lectures or participates in panel discussions about autism on various forums all across India. Now he has been with therapist for a very long time since childhood. But somehow what we have seen is usually he continues with one therapist for about 6 months, 8 months. Then he feels that therapist is not so good, not very comfortable with the therapist. He will decide to change the therapist. And this has been happening over last 8 to 10 years. Earlier, the therapy was not related to autism. And that's why it was more related to learning disability and mental health. Now the autism has come since last 3 years. Actually, he has done MBA, he has joined E&Y, but unable to work effectively. Now my question is basically, how do we help him? What ways? He is at present on medications also about depression, and he's with a therapist also, but somehow we are not seeing significant progress in last 3 years also after the diagnosis of autism. So any tips?
First is, what is significant progress?
Hello?
Yeah, Vivek.
Yes.
Dada, what is significant progress in your understanding?
See, significant progress, what I mean is whatever the temper tantrums or behavioral changes or a psychosomatic disturbances of body ache, headache, loss of sleep in the night, all that is almost same since last 3 years. It has not decreased significantly. Maybe about 2 or 3 days in a week are little better, 5 days are bad.
Okay.
At times, a lot of crying spells are there. At 25 years of age, the way he cries like a child,
Okay.
it disturbs him also, it disturbs us also.
Oh, I would look at it in a very different way. I understand, Vivek. It really disturbs you when an adult starts crying at home. Let's look at in two different ways. One is that congratulations to him for doing so well and honestly doing so well and being the beacon of hope for so many others where he takes lectures. That's a fantastic thing. Now you need to go and talk to the doctor, whoever is the doctor treating him in Dubai or wherever. Take an 1 hour's appointment, sit down with them and look microscopically analyze what is the progress and where he stands. And I think if you reflect on that, you will get a better opinion about him. But even if he's got autism or any other issues with disability, he has a right to suffer from major depressive disorder. He has a right to have other illnesses also. So you spoke about CPT. Vivek? Hello, Vivek? You're mute. Vivek is mute. You spoke about CPTSD. What did you speak about?
I unmuted him and but,
Yeah, he said CPT. CPT.
No, CPTSD, he says. CPTSD.
where is it gone?
I can see it. He talks a lot about CPTSD and getting troubled by it. What exactly he means when he says he talks a lot about CPTSD?
He's not in the meeting, sir. He lost connection, I guess.
He's
He
there.
lost the connection.
I think he's saying post-traumatic stress disorder, probably.
Acha, PTSD. He's talking about PTSD. Okay.
It into CP and
Okay.
A, but
Yeah,
CPTSD.
I think very good question, sir. Of all the bullying, etc., which happened, very targeted therapy for PTSD will help him get over those intrusive memories and disturbing memories, whether he has autistic spectrum or not. So a targeted therapy for PTSD is extremely important. There are good medications and good treatment. A long dialogue with the psychiatrist will help him to alter the medications or change the course of treatment. But all the same, he is doing fantastically well than millions of others who have autism. And congratulations to you parents for really doing so much for him that he has reached at a place where everybody would dream to be. But the small issue which is there can be treated with focused treatment. Do you agree with me, Survi?
Yes, sir. Yeah.
Manjushri, I think Manjushri is his wife, but I think if you want to say something very in brief, it's okay. Harshali, Manjushri has joined. I think it's his wife.
Yes. I'll just I'm unmuted.
Harshali,
Yes.
handling all this unmute is very difficult. Huh?
Hello. Can you hear me?
Manjushri, bola, Dr.
Yeah. Me
Yes,
and
yes.
Vivek, we are sitting together only. So because he is not able to rejoin, I think he is speaking from my
No
mic.
problem, ma'am. What I said
No
is
problem.
that we should have a focused treatment for PTSD. And we are very happy about his progress. But the focused treatment for PTSD, if you're not happy, have a dialogue with the same psychiatrist. Have a very detailed chat for a long time. Take a longer appointment. And I think this can be fixed. It's not so difficult to be fixed. But believe in the psychiatrist.
Sorry, our concern is doing self-advocacy, taking a lot of lectures. We are very proud of him. Only thing, while doing so, he should accept what his issues related to autism are.
No. 1 sec, ma'am. You said he has PTSD. PTSD can happen to anybody, you, me, or him. And if you take focused treatment on PTSD, is something very important. Also, I see that you and your husband are upset about certain issues which we cannot discuss in detail in a seminar like this. I think both of you can take a separate appointment and share your concerns and worries, and maybe you'll come to some understanding and some madhyam marga, as Gautam Buddha said. I think that is the best way. Very difficult to really give a very detailed answer to this problem. He needs to be examined, and you need to also go and have a long chat with the psychiatrist who knows more about him than you, me, and anybody else. Thank you, Manjushri,
Thank
for
you. Thank you. Thank you. Thank you.
raising this issue. Very important issue. Thank you.
Thank you.
Thank you so much, sir. I think we have answered, I mean, most of the questions. Yes, sir, Ashok
There
Sharma,
is one, there is
go
one,
ahead.
there's one question which I want Surbi to answer. It's there on the chat. It is from Vijay. How to treat anxiety? Maybe he's also a parent. So I think we've answered that, Vijay. Anxiety can be treated by yoga, vipassana, at the same time with a chat with a psychologist. And it would be nice if you see a psychologist who's holistic, who has Eastern and Western Gyan, both. And that would really help you. If the anxiety is because of a cause, you need to really address the cause and find answers. If it's anxiety as a nature, as a personality, as part of your fitrat, then you need to go through anxiety management techniques so that it can be really minimized. Thank you, Vijay, for asking that question. Yes, Harshali, over to you.
Yes, Ashok Shah, sir, wants to ask something.
Dr. Harish, Dr. Surbi, it's a wonderful session. And few things taking the lead from Dr. Vivek. To be very frank, the autism was a few years back was difficult to diagnose. And I think, I don't know where it has complicated things in the mind of a child or something like that. It starts with a developmental pediatrician or pediatric neurologist and goes to the psychologist or psychiatrist. Every child is treated first by the developmental pediatrician, pediatric neurologist, and then ultimately for all the certification, we go to the psychiatric department for concession and for the certificate session and all. And sometimes when these kids do get affected, because when both the parents are not in the same track, or there's always argument or something like that, and that also does affect the child mentally, and they also have got a lot of anxiety issue. So it's only the developmental pediatrician will be treating, or we need to approach to the psychiatrist also for the adult child.
It really depends upon the issues. Now, if the adult child has issues of adolescence beyond this diagnosis of, see, but what is very important to understand is that autism or disability is one aspect. There could be consequences, psychological consequence because of same, but independently, he could be having issues of adolescence. He could be having issues of relationships. He could be having issues of query marriage, query education, query career, query confusion. Depending on the issues, you have to choose the person. I would say that a psychologist and a psychiatrist is much better placed to address issues of life than a developmental pediatrician. Exposure to the psychologist and the psychiatrist is much more than a developmental pediatrician, and they are more experienced in handling this. All the same, the role of the developmental pediatrician is as important in so many issues of the brain. But I would say that let's look at issues of children with autism as issues for other children too. And a psychologist first and a psychiatrist second would be the best people. Thank you, Ashok, for asking that question.
Thank you very much.
Thank you so much, sir. This is very insightful session we had, sir. I think, Brian, you want to say something?
Yes, as I mentioned earlier in my chat also, that this has not been a pravachan, but something beyond that, with a lot of humor and very connecting, And as we always say, Doctor, as you have mentioned earlier also, every one of us has stress. There's no person in the world who doesn't have stress. It's basically the way that you handle the stress and how you vent it out, how you channelize it in a right way. Because like Harshali, we are also parents of 2 kids on the spectrum. But then end of the day, if we are trying to help other parents, that it is our way of venting out our stress. At the end of the day, we get peace, we get happiness. So, and secondly, a lot of parents talk about, say what after us. So what we are trying to do is let's get our kids as relatively independent as possible now, rather than more focusing what after us. What after us, Corona has taught us that what after us, no one knows tomorrow what is going to happen. So let's live for the day. And as you rightly said, doctor, take happiness in small bits and pieces. We are not looking at greater joys. We need to steal our small doses of happiness. Thank you so much, doctor.
Thank you.
Our Aditya is here. He wants to ask something.
Yeah.
Dr. Harisha, congratulations for 1MD.
Thank you, beta. Thank you.
Acha. What did you do in 1MD?
Pardon me?
What did you do in 1MD?
It is tomorrow now. Tomorrow, no, beta. We have not planned. We'll plan at night.
Acha, it was a Facebook and YouTube also.
Yes. That is done by our friend Anirudh Sapatnekar, who's volunteered to do it free of cost for us across the last 2 years. We only talk and get out, but he does the show, and we're grateful for Anirudh Sapatnekar for really initiating this. He's the producer and director and writer, and we are the actors. That's what we do, Aditya.
He's the regular follower of that lectures. Regular.
Yeah. Yes, sir. He attends all the lectures and he's very active in.
I know.
Yeah. Thank you.
And I would like to be both. You want to say something? Surabhi, you want to thank all the parents?
Yes. So it was really a wonderful interaction. So many insightful discussions for me also. So I would like to just thank everyone for being there and being there for the entire talk actually.
Yeah,
We
I would
stayed
like,
back for the entire thing.
yeah. Dear parents, I would like to thank you for all the learnings you have imparted to us across time. In fact, we learned autism and disability in my era. Me and Ashok Shah, almost from the same era. We did not have much of experience when we did our MD psychiatry or our DPM, because then it was absolutely new and fresh, and there were no child guidance clinics which are as robust as of now. So a lot of knowledge and experience we have learned by listening to you and by listening to your children, for which we are extremely grateful. And I would like to thank you with folded hands, and we'll keep in touch. Thank you.
Thank you so much, sir. I have no words to express my gratitude towards both of you, Surabhi ma'am and Harish sir. This was most of the, I cannot read that much of direct messages I am getting to thank you personally that they have, opened their husband's eyes, wife's eyes. मतलब उनको ये जो कन्वे करना था अपने स्पाउस को, वो भी इस हमारे सेशन से कन्वे हुआ है. So that is direct help you did to parents. This is the wonderful sessions we have, and looking forward for these kind of session more in future if you allow us.
Brian is put his hand up.
Yes.
Brian wants to say something.
But yes, Brian.
No, that's about it, doctor. Just to thank you, because many a times what happens, a husband is not able to communicate to the wife, and the wife is not able to communicate to the husband. And at the same time, it becomes very difficult to tell either the spouse that we need to go and visit a psychiatrist. So because each of them will blame, what do you think, I'm mad kind of a thing. But then as a third person, you coming on a forum and telling these things, upfront that probably you don't love your child, that makes a direct impact, for those people to introspect themselves that maybe we are going wrong somewhere. So this is something that has to be done.
I do it very rarely as the last resort when everything fails. So it has to be done as a last resort, otherwise people will get hurt. So thank you. Thank you, Snick, Harshali, Brian, Ashok Bhai, Aditya Bhai, for inviting us. We enjoyed every moment and we have learned a lot in this entire process. Thank you.
Same here, sir. Gratitude
you, Dr.
from our SNCC family. Yeah. Yes, sir.
Yeah, thank you so much.
Thank you. And we'll wrap up our session here. Thank you and bye-bye. Good night, everyone.